This combination medication is used to treat minor pain, itching, swelling, and discomfort caused by hemorrhoids and other problems of the anal area, such as anal fissures and itching. It contains pramoxine, an anesthetic that temporarily numbs the area, and hydrocortisone, a corticosteroid that reduces redness, itching, and swelling. It can be applied as a cream or towelette for relief. The recommended daily dosage and optimal timing for using this medication should be discussed with a healthcare professional. Before using Zypram kit, cream, or towelette, make sure to clean the affected area with mild soap and water, rinse well, and pat dry. If applying the product inside the anus, use the applicator tip and follow the instructions in the product package or as directed by your doctor. Gently insert the applicator tip just 1/2 to 1 inch inside the anus and apply in and around the anal opening as directed. Do not insert your finger or any part of the container into the anus, and do not insert the applicator tip more than 1/2 to 1 inch inside the anus. If you are using a single-use tube and applicator, discard after one use. If applying the product to the outside of the anus only, apply a small amount to the affected area and rub in gently. Do not cover the area with plastic or waterproof bandages unless directed by your doctor. This may increase the absorption of the medication through the skin, improving how well the drug works but also increasing the risk of side effects. Wash hands immediately after use and avoid getting the product in your eyes, nose, ears, or mouth. If the medication gets in these areas, rinse the area immediately with clean water. Some brands are packaged in kits with wipes. Before applying the medication, use the wipes as directed. The wipes are usually flushable, so discard the used wipes in the toilet. This product is usually used 3 to 4 times daily, or after each bowel movement, as directed by your doctor. Use the medication regularly at the same times each day to get the most benefit from it. Do not use more of this product, use it more often, or keep using it longer than prescribed by your doctor. If you have been using this medication for a long time or in high doses, do not suddenly stop using it without your doctor's approval. Inform your doctor if your condition does not improve or worsens after 1 to 2 weeks. If you experience redness, burning, or itching at the application site, make sure to contact your doctor or pharmacist right away. This medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Most people using this medication do not have serious side effects, but it's important to tell your doctor if you experience any rectal bleeding, changes in skin appearance, or signs of skin infection. In rare cases, this medication can be absorbed into the bloodstream, leading to side effects of too much corticosteroid. If you notice any unusual side effects such as extreme tiredness, weight loss, headache, or vision problems, be sure to inform your doctor. While a serious allergic reaction to this drug is rare, seek medical help right away if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects that are not listed here, make sure to contact your doctor or pharmacist. Before using Zypram kit, cream, or towelette, it's important to let your doctor or pharmacist know if you are allergic to pramoxine or hydrocortisone, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have diabetes, eye problems, infections, especially rectal sores/infections, liver disease, or stomach/intestinal problems. Using corticosteroid medications for a long time can make it more difficult for your body to respond to physical stress. It's important to inform your doctor or dentist if you are using this medication before having surgery, emergency treatment, or if you get a serious illness/injury. This medication may temporarily slow down a child's growth if used for a long time. It's important to see the doctor regularly so your child's height can be checked. During pregnancy, this medication should only be used when clearly needed and should not be used for long periods of time or in large amounts. It's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Zypram kit, cream, and towelette, it's important to be aware of potential drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. To ensure your safety, keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. It's crucial to always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. This will help to prevent any potential complications and ensure the best possible outcome for your treatment. If swallowed, Zypram kit, cream and towelette may be harmful. In case of overdose with serious symptoms like passing out or difficulty breathing, seek immediate medical attention. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Always keep this product out of reach of children. Remember, it's important not to share this medication with others. Your doctor may also want to monitor your cortisol levels while you're using this medication, so be sure to keep all of your medical and lab appointments. And remember, this medication has been prescribed specifically for your current condition, so don't use it later for another condition unless your doctor tells you to do so. If you have a different condition in the future, you may need a different medication. If you forget to use a dose of Zypram kit, cream, or towelette, use it as soon as you remember, unless it is almost time for your next dose. In that case, skip the missed dose and continue with your regular dosing schedule. Do not use a double dose to make up for the missed one. Remember to use this medication regularly to get the most benefit from it. When storing Zypram kit, cream, and towelette, make sure to keep them at room temperature and away from light and moisture. Do not refrigerate them, and always keep them out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal process. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.